nature incredibly boring. Especially for those of you that have already had anatomy. I'm not going to be one of those instructors who sits there and cares if you know what ridge this is on the ulnar bone and what attaches to it. It's going to make absolutely no difference in your life. I'm going to try to make this so it's going to be not easy to understand, but it'll make sense why you should understand the basics, and how you can build on it. So if I get you a good foundation, that means later on when you are taking care of me, I know you're not going to mess anything up, and everything will be under control. So I do a lot of what I do out of my own self-preservation, and, well, I'm a natural born and raised here in Los Angeles, so I don't do anything without thinking about myself first. It's just the way we are. It's true. At least I admit it. Try to make sure this class is as painless as possible. You are going to have to jump through a lot of hoops. That's just the way that they set it up with McGraw-Hill. I will tell you this. If I was a student right now, go into the grade book before you start any assignments on McGraw-Hill. Because if you just go through with what they have in there for the week, how many of you have a little bit of a life left? You're working. You're now trying to go to school. Many of you are, dating, married, have kids. I don't know, alimony payments, paternity. I don't know what's going on in your lives. Maybe some of you have to pay it for a defense attorney. I don't know, gambling debts, whatever's going on in your lives, doesn't make any difference. But if you have any bit of life left, if you were to go through and do every assignment that's put on there by week, even the ones that don't have any point value, whatever life you did have is gone. So you don't have time. You need to learn how to be efficient. And that's going to be the main thing about getting through the school is be efficient, get through it. Just make sure you pass every class. Take one class one time, move on. How many of you have actually done one of these accelerator programs before? Yeah, they take a lot out of you. And the thing about it is you wind up with people that don't take the class. Sitting there saying, you know what would help the students? If we give them this assignment, so it'll reinforce everything. And it's like, no. Many of you right now are going to take another class right now, which is going to be some kind of, not a science class, but it's going to be a whole bunch of writing. It's going to be something about what is your study technique. Wait till the last minute, snort some Adderall, get it done in a panic, and hope for the best. Yeah, I've been a student. So that's pretty much it. The main thing with this class is don't waste your time with things that aren't graded. It's just too much. Let me see. Other than that, a little bit about me. I've been teaching now at West Coast for I think 10 years, but I've been a teacher for over 18 years. I kind of did things weird. I joined the Army when I was 17. So I was in the reserves. And what happened then was I did my training, got done, and when I was 19 years old, I managed to talk my way into driving a big rig. So I had a big rig license, and I delivered beer in Hollywood. So I drove a beer truck in Hollywood. Moved out, lived in a house with 3 roommates and 15 morons, because I drove a beer truck. People came to my house for parties and thought it was sponsored. Okay? I had a good life, to the point where I even knew the police that were going to break it up. So I was having a lot of fun. Dated a girl that was out of my league. Had this life, crashed a motorcycle, had a lot of fun. Wind up with Saddam Hussein invades Kuwait back in 91. My whole life gets turned upside down. So I got activated, gave up that life. In a matter of 2 weeks, I changed. So I'm in the military. I wanted to be a paratrooper. I was stationed at Fort Bragg, North Carolina. The only reason I came back to Los Angeles was for that girl. We've been married for 30 years now, and I still don't understand her. But I do know that if she does kill me, she's going to sell my kidney on the black market to pay for a good lawyer, which means it has to be fresh, so she's not going to kill me slowly with poison. Quick, painless, those things go in the ice, and I won't suffer. Marry a smart girl, that way you know you're not going to be in pain. Now, when I got done, and I'm going to tell you this, okay, so you're here, you're the only male on here. At one point when you date a girl, you're going to be on a date, and she's going to ask you to look at you and say, what is your ambition? And at 19, my ambition was her. That's it. No thought past that. Let's just get through dinner and a few drinks. That's it. So I did what a 19-year-old boy should do. I lied. I made her think I had goals. I didn't know I was going to marry her. I spent the rest of my life trying to make those goals come true. Um, if that does happen, Yisra, and the girl asks you that, straight up tell her, your goal is nothing more than a class 2 misdemeanor. Keep the bar low. Now, I go back to college after being in the Army, and I'm taking some of these classes, and I can honestly tell you that when I was taking like college math, and the instructor's like, you're going to need this skill when you get done with school, he was wrong. I knew I was never going to factor out an equation. But I did it to get through. And going back to college, it's a whole other level when you've been out in the world. And you have to learn how to study again. And you haven't studied in a long time. And it was a challenge. My first week back to college, I had these two young girls ask me to come to a party. And I'm like, yeah, cool, I still got it. Let me just check with my fiance. And like, yeah, we need somebody old enough to buy the beer. All right, looks like I'm here for education. So I wound up doing that. I go to Northridge, I get done with it, and I wound up going to chiropractic college. So I'm a chiropractor. In the school, you could do chiropractic college. You could do either 3 years or 4 years. I did the 3-year program. Mm-hmm. There were close to 80 of us who started off. There were 12 who made it through.
Wow.
So that was the attrition rate. I was one of the 12. I can honestly tell you, my whole goal was just make it through. Okay, mm-hmm. Never repeat anything. I didn't give a speech at graduation. I didn't have cords. I didn't have any of that stuff. I got mm-hmm. through it though. And you know what happened? The insurance company has never once asked me what my GPA was. Mm-hmm. Neither did the school when I got hired. Okay? They didn't drug test me either. So, just get through. Make sure you get through. My first job as a chiropractor was in the largest mixed martial arts gym in Orange County. So I worked on a lot of MMA fighters, jiu-jitsu, Muay Thai, kickboxers, some crazy stuff. I was affiliated with Nike for a while. I've been in the Beverly Hills area. That's where my practice is now. So I have my own practice. I teach because I enjoy it. It's fun. And I'm doing something new. I'm a qualified medical evaluator for the state of California. So I'm doing medical legal. For some of you, when you get good at doing charts, when you get into the field for a little while and you get some time under your belt, look into medical legal. Because if you have that RN license and it's good and you have some experience, there are law firms that'll pay you up to $100 an hour to review charts. So use the license for whatever you can. There will be times I'm not going to be able to hold these meetings. If I don't hold these meetings, it's not because I don't, love teaching. It's not because you did anything wrong. Okay, don't take anything personal. Don't be sensitive. It's because I get paid a lot of money to go do these evaluations. So I'm sorry, but everybody has to know what their price is. And yeah. And if I told my wife, no, I'm not going to go do these 2 evaluations, she's going to be like, what? Yeah. She's like, no, you're going to go do those. So, and I think on the first, I'm not going to be available, and it'll be because I have the evaluations. But if I'm not going to be able to make it, I will post one of these, a recording from a previous class that's going to cover the same stuff. Now, with the testing, I have to figure out how McGraw-Hill I'm going to be able to get in there and change some questions up to make it so it's more relevant. Because some of these questions are just... you don't need to know the stuff. It's just... Yeah. I don't want to waste your time with a lot of this. I want to make sure that you're going to actually... If you can enjoy the class, you can have some fun. You'll remember the stuff. It'll become your knowledge and it'll grow. If you hate the class and you just get through it, you're not going to remember anything, and it's just going to be, I got through it, I'm done, shut it down, block it off. I don't need you to take my class and bury it down in your emotional level, cover it with scar tissue, and never look back at it again. And that's the way that's the way my anatomy class was. It sucked. So, any questions on this? The other thing is with the discussions, make sure that your initial post is done by Wednesday night. Because with an online class, the initial post on Wednesday is going to help to count as your attendance. Mm-hmm. So make sure you get one done on Wednesday night. The initial post, it needs to be, don't get carried away, but it needs to be like maybe 2 paragraphs, and a paragraph's like 4 sentences. The way it works is the initial post is going to be based off of the video you watch. I think it's the mystery of Anatomy of a Murder or something, Anatomy of a Mystery or something like that. You watch this video series, so week one. You answer some questions at the end of that. Make sure that you answer those questions and you submit those. So when you're done, make sure that you get it submitted. That'll automatically go to your grade book. The first discussion post will be based off of that video you watched. Now, I don't want to sit here and just read everybody's discussions that are going to be the exact same. So after you post that first one, your initial post has to be either to a colleague, one of your classmates, or I will be adding a lot of things to the discussions. So when I add things to the discussion, it doesn't mean there's 3 more posts you have to do. It just means there's an option. You can answer the one that I put for your second post or your third. Okay, it's just options. On discussions, all you have to do is an initial post by Wednesday and 2 more by Sunday night. And on those 2 more, it can be whatever you want. You can answer one of your classmates, you can answer mine, whatever it is. But when you go through and you see mine, kind of pay attention, because I put things in there that I try to make it a little bit more unique. Just so you understand why you should know this knowledge. Let me see. Other than that, the quizzes, those are all, let me see. Sunday night, everything is due. I'm supposed to put down that you're going to have points deducted for every day late. Those are just the standard things. There might be times when, like if there's a holiday or something going on, I might change the due date or something like that. I'm not, this is, for those of you that are actually doing this on your own, and all of you are, this is for me it'd be very difficult because I kind of need guidance. Without it, I kind of would push everything off to the side and take care of it all very late. So I know how I work. I know I'm supposed to sit here and tell you, you need to plan appropriately. No, you're going to plan appropriately for traffic when you go to your job so you get paid. And then you're going to plan appropriately when you get done with work to get home as fast as possible. Right now, this is school. You're paying to suffer, and hopefully you get through it, and you'll be fine at the end. West Coast is a unique place because it is expensive, it is quick, it'll get you through it, but they've done so many students that the alumni, they're very good at getting you a job. The latest report about West Coast is the amount of money you pay and the return on investment is equivalent to Stanford University.
Wow.
Which basically just means you're going to pay a lot, but you're going to be able to work a lot too. Which means your burnout's going to come pretty quick. Something to look forward to. Hey, think about it. As nurses, you're going to take your first job. You're probably going to have night shift in a hospital, maybe something like that. You're going to have the worst hours. And you're going to go to somebody who just had a heart attack and you're going to tell him, you know what? You need to reduce your stress level. You need to get more sleep. You need to eat better. You need to exercise. Okay, all that. And what did you just have? You had a donut that came in the morning. You're the night shift. You're having you're having an energy drink that you have behind your computer. So you're powering down an energy drink, which is nothing more than sugar and caffeine. Your dog doesn't even know who you are because you're gone so much. Your family doesn't know what's going on because you're never home at night. Your idea of getting your heart rate up is when you actually have a panic attack before you go into the workspace. And your stress level is through the roof and you're going to tell everybody how they should lead their life. Good for you. Okay. So the way the world works, but you will make enough money to where hopefully you'll have a good life and then you can pay for somebody else to take care of you. Gotta have goals. Any questions so far? As you can tell, the class can be fairly laid back. I try to have some fun, and I'll make this as painless as possible for you. And you'll remember a lot of the stuff from my class. Let me see. So we'll jump right into this. Okay, what you are going to notice is the slides are from Pearson, but McGraw-Hill is what we're using. They haven't told us to start using I don't like this. I want to pull up the McGraw-Hill one. No, this stuff's easy. We'll do this one. I'll get the McGraw-Hill on the next ones because you'll have those slides. When it comes to anatomy, though, the foundations are the same. The principles are the same. They don't change. So the main thing I want you to be aware of is anatomy is just a study. Anatomy, omi just means to like cut. So an ostomy means to like cut to make an opening. A tracheostomy means, okay, how many actually know what a tracheostomy is? You don't have to be the ones who actually make sure that those things stay open. So the reason why, so we have right up here where your manubrium is, so your sternum, your manubrial notch. So right there, we're going to go in. If you see our larynx, our voice box, it moves the vocal cords. You don't want to be up in that area. So you got to go right into this section. And you got to cut a hole. You cut the hole in there and you put a tube in. Now, why is it that you put a tube in something? Well, if you're having surgery, and it's going to be a long surgery, and you're laying on your back for too long, and you're going to be under a lot of anesthesia and a lot of stuff like that, they don't want to get things too relaxed. So sometimes they'll put a tube in there because it's easier to manage that than to put a tube down your throat and your nose to intubate you. So that could be one reason. Or you could have like damage, swelling, stuff like that blocking your airway. Okay, so tracheostomy. Omi just means to cut things open. Now, when it comes to anatomy, it's the study of everything in the body. Okay, physiology is now going into how things work together. All right, so anatomy usually dictates the physiology, like how things work. Okay, so physiology, function, anatomy, what it is. I wish that we're teaching these together, but we're not. But I will add some of the stuff in there to make it make sense. Now, gross anatomy. So gross anatomy is what you can see with your eyes. So when you look at somebody, you're looking at gross anatomy. Now, some people are grosser than others, but that's gross anatomy. Now, we're going to microscopic. We have cytology. A cyte just means a cell. Histology means tissue. Okay. That's all I need to know that. But that probably will be stuff that they will ask you in the quizzes, okay? Because it's pretty simple. So cytology, cells, histology, tissues. Now, what is a tissue? So a tissue is a group of cells that come together. Okay? So a cell is just one cell. Tissue, a bunch of cells together. So you have to understand this to go into like organ systems. So when it comes to organization, your atom is the fundamental unit of everything. Now, if you think about this, an atom, our planet was actually a dust cloud at one point, and it was made by a bunch of stars that exploded. And when these atoms got closer together, they actually started to adhere to each other, and they formed these balls. And these balls actually got bigger and bigger. When they got bigger, they created a gravitational pull, and they pulled everything together. So everything you see is made out of just atoms. Now, when the atoms come together, they will form molecules. Molecules come together and they form cells. Cells are where we start to kick in. But I need you to understand the atom, because the atom, which is nothing more than we're going to have, the center of the atom is going to be full of protons and neutrons, and outside of that is going to be electrons. You don't need to write this down, just listen for a second. Now, protons have a positive charge and electrons have a negative charge. So if you have one less electron, your net charge will be positive. If you have one less proton and an extra electron, your charge will be negative. Now, to understand why you should have this concept down is because this is what makes bonding. Now, all of you right now are sitting here watching the computer. You're thinking, your brain's working. What is going on inside of your neurons is your neurons have a lot of chloride. Chloride is negative. So I want you to think about this. Chloride is negative. Inside the neurons, we're going to have potassium, which is positive. So it keeps the charge kind of equal. But outside of that neuron, we're going to have sodium that's hanging out. Sodium is positive. Now remember, opposites attract. So think about it like this. Inside of a cell, a lot of times what's going on is sodium and potassium are kind of fighting for dominance. I want you to think about sodium and potassium as they're like two groups of guys. And they're attracted to chloride, especially in a neuron. The chloride would be like the female, a little negative, kind of dangerous, a little exciting. Okay, inside that cell, we already have this potassium that's hanging out with her. But every now and then the girl is like, hey, I think there's something more exciting out in the world. And she sees sodium out there. So she opens up the sodium channels and the sodium rushes into the party. When it rushes in to get to the chloride, we have a net charge of positive running in, so that's positive outside. That creates a depolarization. When that hits negative 70 millivolts, we now have an action potential. That action potential then travels down that neuron. As it travels down that neuron, it's going to have to reset. To reset, whatever happens to sodium, we do the opposite with potassium. So now potassium says, hey, look, chloride, you want sodium? Hey, girl, I'm out of here. I'm not dealing with this. So he leaves. But now what happens is chloride is like stuck with sodium, and chloride is like, you know what, you guys suck. So now they have to turn on the sodium pumps and kick the sodium out, and then go and apologize to potassium and say, come on back into the party. So remember, whatever you do to sodium, do the opposite to potassium. So now we have depolarized, action potential, repolarized, and reset. Now why is that important? Every time they hook up the electrodes and do an EKG, all you're seeing is sodium-potassium, the movements causing muscle contraction, and that's what's going on when you do an EKG to see how well your heart's beating. So understand that fascination between that. It's pretty cool. We actually, wherever sodium goes, water follows. So if somebody has high blood pressure, we put them on blood pressure medicine, and a lot of those things, especially if it's Lasix, what that's going to do is it's going to make them urinate out more sodium. They urinate out more sodium, they urinate out more water. That decreases the blood volume, decreases blood pressure. But if you don't watch it, you wind up with too much potassium because you held on potassium, got rid of sodium. The differential changes, and next thing you know, they get an irregular heartbeat and they go into arrhythmia. And then they died because you controlled their blood pressure. These are the things that you're going to have to think about as a nurse. So if you understand why you need to know this, then it makes sense. Okay, so the cell is the basic unit of life. Cells come together, they make tissues. When tissues, so we have more than one cell, a group of cells, they come together, they form a tissue. The tissues come together and they form an organ. So your organs. So think about this. Your pancreas, we have endocrine and exocrine. Endocrine means it gets released into your body. Exocrine means it's going to be secreted out. So all of our sweat glands, those are exocrine. It gets sweat, goes outside. Okay, our hormones are endocrine. It gets released into our blood. Okay, but our pancreas also has digestive enzymes. So it has more than one function. So it has more than one kind of tissue in there. So that's an organ. But the pancreas is part of what? Our digestive system. And part of our endocrine system. So it becomes an organ system. Organ systems come together and we form an organism. So that's the level of organization. The other thing about anatomy is gross anatomy. Like I said, gross anatomy is just what you see. Okay, so surface anatomy. Now when it comes to surface anatomy, things are a little different. If you take a look, you can see little markings. I already talked about the manubrium right here. So that is a bone, the manubrial notch. Surface anatomy, you can see it. Okay, what do you ladies want in a guy nowadays? You want us guys to be doing ab things like crazy. Okay, my wife, she's like, you got to get your abs back. You're running out of time. And she doesn't just want abs now. She wants that V in the stomach. Do you even know what that V is called, ladies? See, I see Melanie over there. She's kind of laughing and smiling. She's like, yeah, that thing looks nice. She has no clue what it's called, though. You know what you want. You just don't know how to ask for it, but you expect it. Okay? What that V is called in the stomach, it's called the inguinal crease. It's not nearly as attractive as it sounds, as it should sound, okay? It's called the inguinal crease. As my wife puts it, it's just a directional sign. Okay? She says, if you had that, it's directions. Okay. Now, why would you need to know the inguinal crease? Because you follow that inguinal crease down, where it goes into your pelvic region, that is the area where the spermatic cord and the blood vessels that go to the testicles actually go from your abdominal pelvic region into your scrotum. Now, I know I keep picking on your throat, but you're here. You look like you work out. When you're at the gym, why is it when you go to lift heavy? So if you're going to do squats to try to impress a girl, okay, so you go to the squat rack and right in front of you, there's like in the gym, you have all the girls out there, they're wearing their Lululemons and all that stuff, and you can tell what kind of underwear they're wearing. Those things are so see-through, you can almost see what kind of credit card they have in that little back pocket thing. So you're trying to impress a girl with an American Black card. You know that has no limit. So you're going to throw a couple extra plates on. When you squat down, when you come up with all that weight, why do you have to exhale?
Because if I don't, I'm probably going to pass out.
No, you have to exhale for two reasons. One of them is so you make enough noise so in case it squeezes out a fart, nobody's going to hear it. Okay? The second one is because all that pressure builds up in your abdominal pelvic area and your thoracic region. When that pressure builds up, it could push a piece of your small intestine into your inguinal canal, and that's called a hernia.
Hernia.
Yeah.
Mm.
So you don't want to get a hernia, okay? Because then you have to get surgery to have that removed. Because if you get a hernia, that piece of intestine that's in the inguinal canal can actually block off some of the blood vessels that go to feed your testicles. Now, the real problem is it can make it so that the veins can't drain the blood out. So now, if veins are plugged up, we get swelling, we get edema.
Mm-hmm.
But the thing about it is your testicles need to stay 2 degrees cooler than your body. So if we don't get the fluid out of there, it's basically going to put your testicles in a slow roaster.
Oh, no.
And then you can wind up being sterile. And if you're a teenage boy, if something happens to those guys and they die, I guess it's called brain damage too. Okay. So you have to take care of yourself that way. But that is a surface anatomy, that V. Okay, on you ladies, on your back, and the lower lumbar area, sometimes you see these little dimples on the back. Those are called venous dimples. You see, us guys were nice enough to give you a pleasant name. What that is that's the area right there on surface anatomy where your sacral and iliums come together. And right underneath there is going to be where we'd have to go in if we were going to actually give you a shot, an injection to try to block off some pain fibers going from your sciatic nerve. So surface anatomy tells you what's underneath. Regional is just what is where. So regional anatomy in your thoracic cavity, where your rib cage is, that's your thoracic. Okay? Best way to understand that is, if you have a heart surgeon, what is he referred to as?
Cardiologist?
Cardiologist means he studies. A cardiologist is not necessarily a surgeon.
Mm.
So a cardiologist just specializes in the heart. But if you are a surgeon, if you are a cardiac surgeon, if you're a heart surgeon, you're actually called a cardiothoracic surgeon, which means you work in anything in the thoracic cavity. The main thing, though, is the heart. That's your specialty. So the name tells you what it is. The region, thoracic. Okay, systemic. Systemic anatomy. So if you go to a gastroenterologist, and by the way, listen to the terms. Okay, whenever you hear an O, it just means, oh my God, I'm going to be impressive, and throw another syllable in here and connect the words. Okay, gastric is stomach. O means we're going to combine that with something. Entero, the enteric nervous system controls the digestive system. So a gastroenterologist is just a specialist in the digestive system. So when you see an O, it just means we're going to combine 2 words together. There is another syllable in there, and it makes it sound really impressive. That's the language of anatomy. That's the language of doctor. If you can speak Starbucks, you will learn this. Okay. I still have absolutely no clue what a venti macchiato is. Okay. So, systemic, gastroenterologist, what does he study? The digestive system. Okay. Okay, confused on this stuff. This is kind of telling you a little bit about like the regions. Don't go crazy on this. They will try to hit you with some stuff that you'll never really bother with ever again in your life. A lot of times I like to ask you about this. Okay, what is your thumb referred to as? The pollex. Okay, pollex longus is a muscle. The main thing about the thumb is this. It allows you to grip things so you can pull. Pollex. And then they'll say, okay, well, what about the big toe? They call this the hallucis, the helix. The best way to remember this is if you have bad breath, that's called halitosis, which means it stinks. So the helix is the big toe, where it stinks. Okay? Things like that just make it so it gets easier. Now, in anatomical position, the main thing to understand is the biggest part is the hands. They're going to face palms forward. That's really the whole thing. In an anatomical position, you're always referring to the patient's right and left. Cephalic just means head. I'll go crazy on that. Developmental, the main thing about developmental that I want you to understand is the way things usually work is the sperm meets the ovary. Okay, now realize you ladies take 28 days to perfect the special little ovary that's going to have half your chromosomes in there, and you take the time to make it just right. And that guy gets released, and as he's traveling down the uterine tubes, you meet up with a guy, and this guy took enough time to actually produce a couple million swimmers. The majority of those are retarded, and he's going to send 1 million of these guys out. And those million, half of them are going to pick the wrong tube to go through it. The other half are going to pick this tube. And as they go through, it's survival of the fittest. And all of a sudden, in that tube, one of them is going to meet that egg. And as soon as it meets that ovocyte, boom, we actually have a blastocyst. We now have a cell with a complete set of enzymes, a complete set of chromosomes. Now think about this. The strongest swimmer made it there. You're going to deal with patients. And you're going to see people in the world. And you're going to sit there and say, the strong sperm made that? You're going to question nature at times. Trust me. Now, as soon as that ball comes together, that cell, when it gets fertilized, it starts to replicate. As it replicates, it becomes a blastocyst. A blastocyst means it's going to build. A building of cells, cyst. That is going to hit the uterine wall, and it's going to implant. Now, once the uterine wall hits, when it hits that and it gets implanted, now we have pregnancy. And that sparks a whole series of hormones that are going to kick in to maintain pregnancy and to keep things going. Now, that ball at some point is going to form something called a notochord. So it starts to look like a donut. That's going to be the brain and spinal cord. And then it's going to have parts of it that's going to come out and around and cinch together. Everybody, put your tongue on the front of your teeth and feel that little ridge, that line in between your upper lip and your teeth. That little line right there, that string, that's called a frenulum. That is where your body actually came together and fused together. And then it started to form all the organs and everything inside there. So that's how we actually got cinched up. Okay, that's why you have someone with a cleft palate. It means that their palate has this cleft strung off to the side. Cleft palate, it didn't fuse together properly. Now, in embryology, the only thing I really want you to be aware of, and they'll go into a lot of detail on this on the book and all this, but what I want you to be aware of is what the real reason to understand. In that ball, we have your mesoderm, your endoderm, and your ectoderm. Ecto means outside. Endo means inner. Like you get an endoscopy, they put a camera inside you, so inner. Meso is usually like the muscular layer, okay? I want you to think about this. This little blastocyst, it has these 3 layers. Everything's going to develop out of that. Now, connective tissue, we're going to go into this. Connective tissue holds everything together. All your organs have connective tissue in them. Your muscles are connected to connective tissue. Your neurons are connective tissue. So all this connective tissue came from the mesoderm. Now, I need you to understand that because a lot of our autoimmune diseases are connective tissue. Lupus, sarcoidosis, even multiple sclerosis. These are autoimmune diseases where your body turns on some of its own tissues, the cells in the tissues. So if it is a connective tissue disorder, it means it can affect everything, all your organs. So I just want you to be aware of things like that. Comparative anatomy, that's more for like lab, if you go and... The best way to understand comparative anatomy is we usually will dissect a pig's heart because it has 4 chambers, so it's closer to humans. Clinical is just understanding terminology is the best way. Your liver, that's made up of hepatocytes. Hepatitis is inflammation of your liver. So whenever you see hep, start thinking liver. Megaly just means big. Hepatomegaly is a sign of liver damage, liver disease. Surgical. The main thing about surgical is you understand the landmarks, like I just talked about with the inguinal crease. There's a reason why I talk about the things I do. Radiographic, you're going to be nurses, don't worry about that so much. Radiologists can do it. Oh, by the way, AI is going to replace radiologists. Like, that's the first medical thing that's going to be gone. And it's actually not a horrible thing because if AI is going to read the MRI, it's not going to miss things. Okay, AI is never going through divorce, withdrawals, sleep deprived. It's always going to be the same. But you're going to need to have a qualified radiologist just to verify that it's not just an anomaly. But radiologists used to be a very good career, but AI is going to start to replace that. And I'd rather have AI going over my MRIs and then have a radiologist go and make sure it's right. Cross-sectional is basically just, you section things off in an MRI and a CT. It's just how things get broken down. I'll go crazy on that. No, they were predominantly like water. Don't go nuts on that. A little more details when it comes to the elements. This is what they're really going to want you to understand are the different organs, the systems. Just know the integumentary is the largest organ in your body. That's the skin. Skeletal, that is just going to be bones. And bones are there for production, mineral storage. It's also where blood is produced. Okay. Muscular, you hear muscle, movement. So all muscle does is move. Endocrine is going to be chemical messengers. So endocrine is going to be chemicals. Cardiovascular is heart. Vascular just means blood vessels. Lymphatic is the only one that's tricky. Okay, so everybody knows that arteries take the blood from your heart. Okay, veins bring blood back to your heart. Okay, so arteries take blood away from the heart. Veins bring blood to visit the heart. But if you get an injury, so if you get a cut, a big gash, and you wind up with some bacteria in there, that gash, do you want that to go into your veins and directly to your heart? No, because that's going to cause you to go into septic. So you don't want to get septicemia. So what the body does is it says we're going to have a lot of inflammation in that area. In that inflammation, we're going to have swelling. That swelling is going to be a lot of water and a lot of white blood cells. So those white blood cells are going to fight the infection. But we don't want to risk that going into our veins. So what we're going to do then is we're going to take that extra fluid and we're going to drain it through the lymphatic system. The lymphatic system has lymph nodes, these little nodules, these little spots on this traveling. And those lymph nodes, they're full of more white blood cells. So they're going to purify that liquid from that swelling. I know a lot of you probably sprained an ankle. If you sprain an ankle, they want you to elevate it to try to get the swelling out. It's not to try to get the veins. We're not doing that. We're trying to get the swelling through the lymphatic system and let the lymph nodes clean it. And then when that fluid gets cleaned before it gets into your subclavian vein where it gets dumped, then that clean fluid goes into your subclavian vein and then into your heart where now it's part of your blood again. Okay, to understand this in a better women, why is it that you need to make sure that you do regular breast exams? Because if you wind up with breast cancer, and because your breast tissue changes a lot according to hormones, if you get breast cancer doesn't have to travel very far before it goes into your subclavian vein. So it doesn't go through a lot of lymph nodes. That's the reason why early detection is imperative when it comes to breast cancer. A lot of cancers travel through your lymphatic system and then it goes into your blood and now it's metastasized. Metastasized just means it went everywhere. Okay, so your lymphatic system is for fluid and immunity. Respiratory is just breathing, heart and lungs. Digestive, teeth, esophagus, stomach, small intestines, large intestines, liver, pancreas. So digestive system, just the breaking down of nutrients. Urinary is unique. In the urinary, it gets rid of waste. So it controls fluid as well. We control our fluid by controlling our kidneys. Okay. And reproductive, it's just so, we all have the internet. When we talk about metabolism, this just means how well we can process nutrients, how well we use up energy. So anabolism is to bring things together. The best way to understand that is what kind of steroids build muscle? Anabolic steroids. So anabolic means it's going to build muscle. Catabolism just means to break things down. A catastrophe means things are broken down. Okay. Excretion is just getting rid of stuff. Let's see. I already hit all these things, so I don't want to go crazy on it. Okay. Supine and prone, you're going to have to know those. Supine is laying on your back. Prone is laying on your stomach. The prone firing position in the military is on your stomach with the weapon up. These are going to need to know just because, when it comes to like surgery and stuff like that. Let's see. Anatomical position we already talked about. Just know that the cranium, craniofacial, is going to be the whole head. Cranium is just where the brain is held. Facial is what you can see. Usually, though, the maxilla is the area right here from the nose, and it comes over. It's the frontal portion. The doctor that I work with, that I'm in the office with, he is a maxillofacial reconstructive surgeon. The maxilla is the main bone in the face. So maxillofacial, okay? Maxilla in the rest of the face. Reconstruction means he made his money fixing bad nose jobs. Oris just means mouth, mental is the chin, so don't go crazy on this stuff. I want you to be aware the axilla is just the armpit, because in the armpit we have axilla, lymph nodes, things like that. Brachium, be aware of the brachium. The brachium is going to be this part of your arm. The brachial plexus is where the nerves come down from your spine and go into your arm. Brachial artery, things like the brachial artery is going to be up in this area. So brachial just kind of tells you where it is. It's the upper arm. So if that's the brachial up in this area, the antebrachium is going to be your forearm. Usually they're going to say forearm, except for when you're in school and they want to sound intelligent. You're never really going to hear them talk too much about like the crural, stuff like that. Just they'll say the lower leg. Everybody's kind of calm on that. Just know dorsal is to the back. Usually they're not going to say dorsal. Usually it's going to be posterior. Posterior is towards the back, anterior is towards the front. Let me see. They're usually going to use quadrants. So on a quadrant, when it comes to your abdominal pelvic, so the best way to understand it is, this is your diaphragm that goes up here. So this is going to be your thoracic, and this is going to be your abdominal pelvic. It's going to be in this area here. Of course, I use black, it doesn't really show up. So this right here is going to be the patient's right. This will be the patient's left. Okay, so this is going to be the right upper quadrant. There should be a U in here. Okay, just know that the right upper quadrant is the main one that you're going to deal with, because it has your liver, your gallbladder, your stomach, small intestine and large intestines in there, and it has your duodenum. The duodenum is the first part of your small intestine. So the duodenum is where we're going to get our pancreatic juices and bile and enzymes that come from our liver. Okay. This right here will be the right lower quadrant. Okay. The main thing is if somebody comes in and they have pain in the right lower quadrant with the temperature and it's very precise when you touch it, you start thinking appendicitis. That's where the appendix is. Okay. If the appendix ruptures, then what we're going to have now is fecal matter and all that fun stuff that is there, because realize, and just think about this for a second. Everybody here has had, you go downtown LA and you get that danger dog, that bacon wrapped hot dog. Those things smell good with the peppers and all that. You ever notice the guy that's actually sitting there making those things doesn't have anywhere to wash his hands? You don't see any refrigeration. Before the club closed, he was probably talking to his buddies and might have been pulling the chonies, his thong, out of his crack. You don't know, okay? So he's sitting there making these hot dogs and handing it to you, and in that paper, you think everything's fine. Then you put the hot sauce on. But he could have been sitting there, with his hands with special choni sauce, and you go and you eat that and you think everything's fine, and then next thing you know, you get yourself pretty bad food poisoning. So you get some E. coli in there, and all these bacteria and all that stuff. If you get food poisoning, what's the first thing that happens? Cramping up, you might throw up, then you get really bad diarrhea. Okay, so your small intestine is very liquidy. That liquid then goes into your large intestine. That connection is right here in the right lower quadrant. So as the fluid is going up from your right lower, right upper, and then it goes in a transverse and it comes down, all the liquid is being taken out of that food. Now, diarrhea, you have a transit where it just goes through, it stays liquid. But usually we reabsorb all the water. And then what we're left with when it comes down into the lower, to the left lower, then the transverse into the colon, we now have what's referred to as, poop. So I just want you to think about this next time you get around romantic with somebody, that the saliva that was in their mouth and all that water at one point was probably part of their fecal matter that was reabsorbed into the body to be reprocessed. Keep the romance going. Okay. But that's anatomy, physiology. You understand all this stuff. Okay, so what if it is left upper quadrant pain? Left upper quadrant pain, the main thing we're going to start thinking about is spleen. What if they were in a bad car accident? So if they were in a bad car accident, the momentum of the body going forward, airbag going off, you're going to stop right away. But sometimes that stoppage, the connective tissue in the spleen will tear. So now if they have really bad pain in their left upper quadrant and their blood pressure is dropping, if their blood pressure is dropping, it means that they have bleeding internally. So the blood pressure is going down and they have a lot of pain in the left upper quadrant. So I'm thinking maybe they ruptured their spleen. Left lower quadrant, a lot of times with the left lower quadrant pain, if it comes every few weeks and they have an irregular menstrual cycle, it could be polycystic ovarian disease. So usually it is going to be quadrants. Unless you're in school. And then they want to do regions. And I'm not even going to bother to go into regions with you because you'll figure it out. It's easy and then you'll never use it. When it comes to regions, just not going to be too many questions on that. Directions. So superior means upper, inferior means lower. Anterior is ventral, front, posterior is to the back. Medial and lateral. Those are usually going to be used when it comes to reading where something is on an MRI or something. Because if we get your thyroid done, your thyroid is a gland right in here. So we did the left lobe, and it was the superior, so left superior lobe. But if there was a nodule, it'll say medial aspect, so middle of that lobe. Okay. Lateral just means off to the side. So we actually, when our skull comes together, we have, let me see, the coronal, it's like a crown, it goes in this direction. So coronal is going to separate the body into anterior and posterior. Sagittal is in the middle. It's going to separate the body into left and right halves. Medial sagittal is right in the middle, separating equal parts. But if it is left lateral, it is off to the left side a little bit, where we're sectioning things off. That makes sense to everybody? It's pretty simple, but sometimes people get confused when they actually see it on the test. Proximal and distal is the only one that really does get a little confusing because proximal just means closer, distal means farther. Sometimes you have to put down a reference. So like if the elbow or the cubital, antecubital, proximal would be closer to that area, distal would be farther to that. But they don't put a reference in. Usually proximal means farther away from the heart. I'm sorry, usually proximal means closer to the heart, distal means farther from the heart. Best example is I recently ruptured my bicipital tendon and had to have surgery. Well, I actually put pictures of it too. I had the surgeon take pictures of it. And the tendon for my bicep, it was the distal tendon. So it was the one that's attached onto my ulna. If it would have been the proximal tendon, it would have been the one that comes up to this area here and attaches onto my shoulder, my scapula. So proximal tendon, distal tendon. For what? The biceps muscle. So this kind of tells you directional. When I had the surgery, so I'm coming to in the recovery room, and as I'm in the recovery room, I open up my eyes, And there's this lovely young lady with like long curly hair with a friendly smile. And I'm coming out of surgery. And the first thing in my mind is, I didn't make it. I'm totally out of my, I'm still on good drugs. Like, wow, okay, I got a dark-haired angel coming to take me. Which one am I going? Okay. She says, Dr. Stewart, I don't know, maybe. I'm all drugged up. She goes, I thought it was you. I just wanted to say hi and make sure you're okay. I'm like, all right. She goes, I was your student. I actually taught her during COVID. I never met her in person. She was just a picture on a computer screen, and she assisted on my surgery. So it was pretty cool. I remember asking her if she was happy with her job, and she said she loved it. Part of the reason why she loves it is she's in surgery, where she doesn't have to deal with anybody because they're unconscious. I don't hear anybody complain. Just knock them out. Okay, it's a great patient. Okay, so sagittal. Where I talked about sagittal. Sagittal means just divided into left and right, transverse, anterior and posterior. Let me see. So, coronal, anterior, posterior, sagittal. Right and left, transverse, superior and inferior. Don't worry about the serial reconstruction. When it comes to body cavities, all I want you to be aware of is our cavities are going to be lined. So in our body cavities, the lining inside of our body cavities is going to be referred to as parietal. Okay? The lining around the organs is going to be referred to as visceral. Okay? So visceral wraps around the organ. The parietal wraps around the cavity. Okay? Now in between the visceral and the parietal, we have a fluid, a serous fluid that needs to be sterile. Our lungs are constantly moving. So our parietal pleura is for lungs. We have two sets of lungs, but different lobes. Okay, so the parietal pleura is going to be the lining of the thoracic cavity. This is your thoracic cavity. Okay, the visceral pleura, and the visceral is going to be what's wrapped around the lungs. So the space in between there has serous fluid. Now, if that space in between isn't fluid, it starts to fill up with air because there's a puncture in the lung. And every time the patient takes a breath in, air comes in. But when he goes to breathe the air out, he exhales through his mouth, but some of the air goes through the lungs and it starts to fill up the cavity here. So now we have air as pneumo, and it's filling up the space in the thorax, pneumothorax. As that air keeps filling up, every time they exhale, more air gets in. What that's going to do is take up space. When we have space and it starts to get taken up, it starts to crush the organs inside and move them around. So if that air is taking up space, eventually it starts to push the lungs. So the lung on the side where the injury is starts to get mushed. The trachea and everything else moves away from that area, the space. And has anybody ever seen when they relieve that pressure? As a nurse, you might actually do it. And you take a pneumodart. It's like it's a needle. And you slam it in there to get between the ribs, and you open up the valve, and you actually hear the air come out like you let an air out of a tire. The pneumothorax gets relieved, and the lung goes back, and they start to breathe better. Pneumothorax. Where was it? Air was where? Pneumo, air between the visceral and the parietal pleura. Okay, but what if somebody has heart surgery, and they wind up with a problem in their heart? They get an infection in there. So that's going to be the para. Para means around pericardial space. So if they get an infection in there, they're going to have some problems as well. Okay. This area right here is the abdominal pelvic region. So because we don't have bones in the anterior of the abdominal pelvic region, we have like muscles and connective tissue. So that is referred to as the peritoneum, the peritoneal space. So I talked about if you were to get a rupture of your appendix in the right lower quadrant, that liquid from there would actually go into your peritoneum. So the peritoneum, if it gets an infection in there, that's called peritonitis. That's the problem with a ruptured appendix. It goes into peritonitis, and then it starts to eat away because in your abdominal cavity, we have a lot of fat and protein and stuff like that. We get an infection in there, and it's going to start to eat away and cause more damage into your intestines, and next thing you know, you're going to have more intestinal stuff, and you're going to bleed out, and you're going to die. But by the way, almost everything in healthcare ends with you're going to die. Okay, that's your thoracic and your pelvic, right in this area. We already talked about this stuff. Just so the diaphragm separates out the thoracic from your abdominal pelvic, you'll be fine on that one. The posterior cavities are just referred to as, those are where your meninges are, so that's going to be your brain and spinal cord. A little more detail on that stuff later. How's everybody holding up? That's an explosive thumb thing. I like that. Let me see. Okay, now to go into the cell. The cells are easy. Okay, can everybody see the cell? Okay, what I want you to understand right now before we go any farther is surgery is going into somebody and it is removing something, fixing something, replacing something, adding something. Okay, I had surgery. I have 2 titanium anchors that are in my forearm to hold everything in place while I healed. Okay, that's surgery. What is medicine? Okay. There's a reason why surgeons want to be said, I'm a surgeon. Okay, because that means that they're actually cutting in and doing something. A doctor of medicine, what he's doing is he's actually given a chemical. And that chemical, that medicine, is going to have desired effect. However, that medicine tends to go throughout the whole body, which is why we have side effects. A medicine works at the cellular level. It's going to turn something on, it's going to turn something off. Okay, how many of you right now know what peptides are? It's all the rage out there. All a peptide is. So, when you eat protein. What protein is a bunch of amino acids. Amino acids are put together in a long chain. You take those chains and you fold them into a specific shape, like origami. Okay? So origami, if you can fold a napkin up to look like a swan, cool. That specific shape is going to be a protein. Now, a peptide is just the proteins. So if you can have a protein that is in a specific shape that's going to cause a desired reaction inside of a cell. Okay, you take aspirin, acetaminophen, those non-steroidal anti-inflammatories. They have a protein in those that has a specific shape. And when it actually hits a cell, and on every cell it has these, pretty much like a key. The cell has these protein receptors on it. If that shape hits this receptor perfect, it can trigger a reaction inside the cell. So now we know exactly what protein to take that's going to turn on the melanin production in your hair, so you're no longer going to have gray hair. So they know now what kind of peptide protein is going to be used to turn on a desired reaction in your cell. Problem is, it's not FDA cleared, so you never know where you're going to buy this stuff from. So if the trainer at your gym is like, hey, I got this like peptide, you take this, it's going to make your muscles grow faster, he doesn't know where he got it from. He could have got it from that same lab out in 29 Palms that was cooking meth yesterday. Yeah. I don't suggest taking stuff like that, but once it gets approved, I'll be on that stuff right away. Okay, so your cell. The cell is the fundamental basic unit of life. Okay, so we have trillions of cells in our body. They used to say that we have almost as many bacteria cells on our body and in our body as we do cells of our body. I need you to understand something about microbiology, because I teach microbiology as well, or I used to. Microbiology is amazing. And think about this. Bacteria can live without us, but we couldn't live without bacteria. We need to have bacteria in our intestines that makes vitamin K. Vitamin K is necessary so we can have blood clotting. Okay, so our cells are the building block. Now, cells can divide from pre-existing. The main thing is cells form the functions of our body. Now, a sex cell are a gamete. So in males, it's a sperm. In women, it's an oocyte. Okay? You see, you even have to make it so you're hard to say, you women. Like, I love you women, okay? I grew up with older sisters, but it's kind of uh-oh. Because you know what? When they're producing that thing and it gets released, you never know their mood. Okay? So, what's going to happen though is in a sex cell, a gamete, it has half the chromosomes. Okay, 23. Somatic means now it has all the chromosomes. Okay? Don't go crazy on this. And this right here will tell you this is what it takes. And one of these little guys is going to get in there. And you think about this, ladies. How much time did you put into making that egg perfect? A lot of work. What did the guy do? He shot out a couple of million morons hoping that a few of them can make it distance. These get confusing with this. So cyto means cell. Plasma just means liquid in space, really. Okay, plasma just means liquid. Okay, plasma is liquid. So cytoplasm is going to be inside the cell. So inside the cell is also going to be intra. Intra what? Cellular. So the cytosol is going to be the fluid inside of the cell, which is also the cytoplasm. So I have to try to make things seem really confusing. An organelle just means that it is going to be structures that are inside of the cell. So the mitochondria is an organelle. The mitochondria makes energy, ATP. We'll go into more of those things. I don't want to go crazy on that because you're not going to need to know too much of this stuff. The plasma membrane that you're going to need to know. Okay, so plasma membranes. So the cell membrane is going to be the cell wall. The nuclear membrane, because the nucleus of the cell is the headquarters where the DNA is kept. So that is walled off from the rest of the cell. Okay, nuclear membrane is going to be the wall around the nucleus. Plasma membrane is the cell wall around the whole cell. Okay. When it comes to organelles, the only thing I want you to be aware of, really, and they go into more of this with the book, is mitochondria. We'll talk more about mitochondria as the class goes on. Mitochondria, it sounds like mighty, so it's strong. It makes the energy. So mitochondria makes the energy. Now I want you to think about this. The more we use our muscles, the more energy is needed. Now we breathe to get oxygen. The main source of energy is going to be glucose and oxygen. Okay. So C6H12O6, that's glucose. H2O. So we have glucose and oxygen. They come together, and they're going to get broken down. So in the cytoplasm, in here, we're going to start to break down glucose. So as we break down the glucose, we're going to break it down, and we're going to turn it into pyruvic acid. That goes into the mitochondria. The mitochondria then is going to use that. It's going to make it into ATP. Now, ATP is called adenosine triphosphate. So it means it has 3 phosphates. What's a phosphate? It's nothing more than an atom. Okay, that is the active form of ATP. That is going to be energy that gets used. Now, I just want you to listen so you understand how this plays out. How many of you know what creatine is? Creatine phosphate. Okay, Alexandria, Sorrel. People that go to the gym, or people that go to the gym, they'll take creatine phosphate before they exercise. Now, the reason why they do that is because creatine is another molecule that holds onto a phosphate. So it's holding onto a phosphate, and that gets into the mitochondria. Now, ATP isn't made yet. Before we go to ATP, it becomes adenosine diphosphate. So di means 2. So that is a stable form. The creatine then donates the phosphate and makes it into adenosine triphosphate. So now that's the active form. The creatine that was holding the phosphate, now the cell's like, hey, I got no use for you. So now it gets rid of the creatine. That went from being creatine phosphate to creatinine. That creatinine then goes into your bloodstream, and it goes back to your liver, some of it. We add another phosphate to it, so we can use that for energy. But we're going to get rid of some of that creatine. So creatine phosphate that donated as phosphate is now creatinine. Some of that creatinine is going to get cleared by your kidneys, so it comes out in our urine. Why is that important? As nurses, you're going to send off a urine sample to see if there's an elevated level of creatinine. The creatinine clearance says how well the kidneys are functioning. If we have too much creatinine in the bloodstream and not enough in the urine, it means we could have a problem with the kidneys. But if we have a lot of creatinine in the blood and a lot of creatinine in the urine, it can mean that the organs are failing. So these are ways that you actually know how the body is working. Does that make sense? And that's why you need to understand this. Okay. The nucleus, right in this area, that is where our DNA is kept. When you see the ribosomes, these little dots, the thing about ribosomes, our ribosomes are important in just one little simple thing. The ribosome is where protein is made. Okay? The instructions to make the protein came from the nucleus. Why are steroids so powerful? Steroids are fat soluble. The cell wall is primarily made up of fat. The nuclear membrane is made up with a lot of fat. A steroid can go all the way through the cell and get to the nucleus, and it can work on the cell at the nuclear level. So that's why steroids are so strong. Non-steroidal anti-inflammatories, your NSAIDs, they can't get through the nuclear membrane. So they attach onto something on the outside and trigger a reaction inside. Non-steroidal, stay outside the cell. If it's outside the cell, that means it's not in the cytosol. Okay, the main thing I want you to be aware of is the plasma membrane. Okay, so the plasma membrane is a phospholipid. Listen to the name. Lipid means fat. Okay, so a lipid means fat. What do we know about fat? If you put fat and water together, do they blend? They stay separate. So you have an oil spill. So whenever there's an oil spill in the ocean, oil is fat. So oil floats up on top. Okay? It doesn't mix in with the water. Just understand it like that. Okay. A phosphate, though, phosphate loves water. So lipids hate water. Phosphate loves water. But a phosphate and a lipid can actually attach to each other. So now we're going to have one side that points out to the water and the other side that points away from the water. So if we line these things up, we can make a wall. Now in between that phospholipid bilayer, we're going to have proteins. So a protein is a bunch of amino acids in a specific shape. Glyco, where I talked about glucose. So you see glyco, anytime you see GLY, just start thinking sugar, glucose. Sterols are cholesterol type of fat. Okay, now what I want you to be aware of is we have your phospholipid bilayer. So the little dots up here, these circles, that's a phosphate. It's pointing towards water. So this area right here outside the cell is extracellular, extra outside. Inside is the cytoplasm, are intracellular. They're both made primarily water. So the phosphates are pointing towards the water. The lipid tails are saying, get me away from the water. So these guys right here make this really nice wall. But we can't have a wall around a life form because if we sequester it off, it's not going to survive. So what we do is we put channels in there. We put gates in there. We put a way to make things get inside. Okay. So we can have a channel that's always open. We can have a gated channel. And sometimes what's going to trigger the gates, a lot of times, is going to be these proteins out here where things can attach to it. So for example, insulin attaches onto one of these guys, an insulin receptor. When insulin attaches on that, it can trigger this gate to open, which allows glucose to go into the cell. Which is why with diabetes, if we have too much insulin that gets released constantly, it wears out these receptors. And next thing you know, we get insulin resistance, which then means it's hard to get the glucose into the cell. Type 2 diabetes. Okay, so this is the phospholipid bilayer. Peripheral just means on the outer. So in other words, now the peripheral proteins, they attach onto the cell wall, and they can cause a result. When something triggers them, it has an effect inside the cell. Integral just means embedded, so those proteins can make channels, which are always open, or gated channels, which need to have something open them. Okay. We already talked about glycolipids, glucose. Now the thing about it is, for something to get into a cell or out of a cell, the cell is going to be selective. It says what it wants in, what it wants out, which is why the cell wall is considered to be selectively permeable. It selects what gets in and what gets out. Okay. If something was impermeable, nothing gets in or out, It's not going to live long. Freely means it just happens without any issue. Selective means the cell is going to choose what gets in and out. Now, to understand this, passive just means we let it happen. So passive diffusion, it means we have a high amount of a substance outside of the cell and a low amount inside. So it just passively goes in. The best way to understand it is oxygen. Our cells need oxygen. So if we have a high amount of oxygen in the cytosol, in the extracellular, and a low amount of oxygen inside the cell, oxygen just freely goes right through the cell wall because the cell needs it. Okay? Every time you take a breath, we're going to breathe in oxygen. Oxygen is going to attach onto the red blood cells, the hemoglobin. As that goes through our body, it's going to release that red blood cell, the hemoglobin is going to release the oxygen. So the oxygen is going to go into the extracellular fluid. That extracellular fluid with high amounts of oxygen, and there's low amounts of oxygen in the cell because the cell's been using the oxygen for energy, that oxygen will freely just dissolve, diffuse, straight into the cell so we can use it for energy. Diffusion. Osmosis is just the movement of water. Don't go crazy with that. Facilitated means we need to have something that's going to facilitate the diffusion. Best way to understand it is insulin facilitates the diffusion of glucose into a cell. I'll explain all this to you so you will never forget in just a minute. Okay. Active transport means that the cell is going to use energy. It's going to actively try to grab something and bring it inside. Endocytosis, remember endo is going in. Endocytosis means something is too big to fit through the channels, so the cell then has to grab it and pull it in, and it makes a wall around it and brings it inside so it can be processed. Exo means we're going to get rid of it out of the cell. Exo, cyto is cell. So when we make a hormone, those hormones that were actually made in the cell sometimes will be carried over to the cell wall and then dumped into the bloodstream. Okay. So how are you going to remember this? Okay, so passive transport, no energy is used. The best way to understand how things get into and out of a cell is Las Vegas. Okay? I'm sure all of you have been to Vegas, right? You know, the big ATM in the desert. Okay, so in Vegas, you're going to have a casino. Inside the casino, that's going to be the extracellular, outside of the club. So in that casino, you have a lot of people. Okay? The nightclub that opens in the casino, that's going to be the cell. So when it first opens, it just opens up the door, and people can passively just go into the club. Okay? Passive diffusion. No energy is needed. Easily gets inside. Okay, now the club becomes popular. So when that nightclub becomes popular, it's going to select who gets in and who doesn't. So in order for me to get into that nightclub, what do I need so I can get in? I need a woman.
ID?
No. You see, you ladies have
Money.
never. You see, you ladies have never had to worry about this because in that nightclub, you are going to be what they just let in because you're going to facilitate guys coming in. My wife has special clothes for Vegas. Heels are higher, skirts higher, shirts lower. You know, boob glitter, everything pushed up. So, my wife looks high maintenance. So my wife makes me look successful. So my wife, she will facilitate me getting into the club. She's my carrier protein. She's my insulin to get into the club. Facilitated diffusion. Okay, now, when the club becomes dull and nobody's going there anymore, so now the club is starting to die off. So now the club says, hey, how are we going to get people in? Okay, there's a lot of females here. You're all lovely. So let's say you don't want to be nurses. You're going to run off to Vegas and go live out whatever dreams you have in Vegas. So to get a job in Vegas, maybe you're going to be the young lady that's hanging outside the club with the drink coupon. So now the club hired you to try to get Cyril, who just won at the casino, as he's walking by flashing cash. You're like, hey, come on over here, big spender, come on. And now I got a free drink coupon. So what you're doing now is the club hired you, so they're spending money using ATP to attract what it wants inside. Active transport. The club is actively trying to get somebody inside. So that is how things get into and out of a nightclub, just like a cell. Does that make sense? gated channels. Now, endocytosis is basically you have a molecule that is too big to go through the channels. So endo means now we're going to grab hold of it and we're going to pull it inside, because the cell wall can actually wrap around and form a vehicle, a vesicle. That vehicle then can actually take that substance into the cell and into the Golgi apparatus for processing. Or that vehicle can take a product the cell made and bring it to the cell wall and join the cell wall and just dump that product into the extracellular, into the bloodstream. That's how we get rid of waste in the cell. So endocytosis into the cell, exo out of the cell. The only reason we have to talk about osmosis is because water freely goes from one side to the other side of the cell. So what controls the flow of water is pretty much going to be sodium. So if we have too much sodium in the cell, water is going to flow in, and too much water is going to make the cell expand and it can pop. Not enough sodium, then we're going to have liquid go from the cell to wherever the water is outside the cell, and it can make it shrink. So if you were to drink seawater, we would get too much sodium. Too much sodium in the extracellular fluid causes the water in the cell to leave, which then will make the cell shrink. ECF just means extracellular fluid, means outside the cell. Don't worry about non-membranous and membranous. When you see the term lyse, that just means to destroy. So we have lysosomes inside the cell that will destroy invaders. But if the cell starts to go bad, it starts to become cancerous. Sometimes the lysosomes will actually just release a lot of these enzymes and destroy the cell so it doesn't become cancerous. Filaments are just kind of like, they're just filaments. They're walls. They hold things up. They're structural. So filaments are structural proteins to help maintain the shape of the cell. Microtubules, don't worry about that stuff. Just notice cilia. It's like a hair. The only cells in our body that have cilia are going to be in our airways. The cilia will actually take the mucus and push it out. Okay. Microvia, what that does is it just increases surface area. That's going to be mainly our intestines, so we can absorb. DNA, Golgi apparatus, all that stuff. Don't worry so much about this stuff. These are just the junctions that actually hold the cells together. Okay. This is kind of important that you know this. So in a cell, the interphase is just the time that goes on when the cell is just doing what it's supposed to do. Okay. Now, what happens is this cell from interphase is going to say, hey, it's time to actually go into, from interphase, we're now going to, the cell's going to divide. Okay? So a lot of times growth hormone, when it comes to our epithelial cells, which just line everything, they're going to say, time to make more. So what happens now is we go from interphase into mitosis. Mitosis is where the cell is going to divide and start to grow. Okay. Now, think about it like this, is they go into a lot of these details. All you need to know is this. So prophase is the prep. Things are getting ready. Metaphase is things are lining up. Anaphase, things are separating. Telophase is when we have two new. Okay. So the best way to actually think about it is like this. So it's PMAT. So if you were to take your hands, your fingers, and you put your hands like this. So in prophase, our chromosomes would be our fingers. So our chromosomes now have duplicated. We have two sets of chromosomes. That's prophase. Metaphase, they line up in the middle, and if your elbows go to either side, these are the centrioles. These are the cowboys in your cell. They have now lassoed onto the chromosomes. They're lined up in the middle. Centrioles are on either side. Polar on either side. That is going to be metaphase. In anaphase, we pull them apart. So in anaphase, the DNA gets pulled apart. In telophase, we now have 2 new cells. That's simple. Prophase, metaphase, anaphase, telophase. Now, I used to always like to write that down when I taught in person, because then I would know where the students are in the test. I see them doing like dance moves. So the thing about it though is this. If you are going through this cell development, the cell is going to grow, or it's going to divide. That right now is when the cell wall and everything is at its most susceptible, which is the reason why if you have damage in your lungs and the cells are trying to replace that damage, the epithelial, but you're a smoker or you live in LA where you have a lot of carcinogens, the carcinogens, if they get into the cell at that time, especially when it's trying to replicate, it can get into the DNA easier. And then that replication can turn into cancer, which is the reason why epithelial cells, they wind up going cancerous, especially in the lungs, a lot easier than others. If you haven't even path, I'll explain that a lot better. Okay, so mitosis, 2 identical. Meiosis is making our gametes, which are what? Sperm and the oocyte. That's going to go through a second round of mitosis, but now it's called meiosis. So what happens now is we're going to wind up with 4 cells, each one with half the chromosomes of the original. I need you to understand how this works, because especially when it comes to like our blood is being made in our bone marrow. So our blood has what's called a pluripotent. Just listen to this. Pluripotent stem cell. It's a stem cell. Stem cell means it can change into whatever it's supposed to be. Okay, it has not differentiated yet into what it should be. That stem cell can divide, and it'll divide some more. And it's going to decide what it wants to be. That stem cell can become a red blood cell, a white blood cell, or a platelet. If that stem cell gets cancerous, because remember, it's constantly moving, it's constantly dividing, which means it needs a lot of energy. So if it becomes cancerous and it starts to produce a lot of white blood cells that never matured into what they're supposed to be, that's leukemia. Emia means blood. Leuko means white blood cell. Now, all of us have a friend that never matured. He was cool in high school, but now he's a loser. Takes up space. Doesn't do much. That's a cancer. Immature. Never grew up. Did not differentiate into what it's supposed to be. Okay? Leukemia. Some of you are laughing more than others. You have those friends. Some, it's a relative. All of you right now are going to nursing school. You are differentiating into become what you're supposed to be, productive. If you become cancerous, you never differentiated, you become a problem. Let's see. That part's easy there. Okay, this is tissues and embryology, right? Everybody can see it? Right. The main thing about this one is, remember, atoms come together, they make molecules. Molecules come together, they make cells. Cells come together, they make tissues. Tissues come together, they make an organ. Organs come together, they make an organ system. Organ systems make an organism. That's the end result. Okay. So just know that epithelial is usually going to be the outer set of cells. They are disposable. So in other words, we're not going to spend a lot of time giving them nutrients. Okay, we don't really care about them. Connective tissue, what does it do? It is going to hold stuff together. Okay, all of our organs have to have a lot of connective tissue to keep them in place. Muscular tissue, that's for movement. Neural tissue, that's just your nervous system. Don't go crazy with that. So neural is for control. Okay. So the main thing about epithelial tissue is going to be bound very close together because it's going to form a barrier, protective. So remember the epithelial tissue that has cilia is pretty much just going to be in your airways. So the cilia in your airways actually help to get the mucus out with any debris in it. So the best way to understand that is your lungs. They're going to clear the mucus out using the cilia. Okay, so your lungs, you can make a loogie because you actually cough it up. Okay, that's the cilia bringing everything out. The microvilli, what that does is it increases the surface area. More surface area, the greater the chances of absorption of nutrients. Microvilli, found in digestive tract. Cilia, airways. Now the cilia though can only be in, if we have cilia that's sticking out with mucus, eventually the airways get so small that we can't have cilia anymore. So now we don't have cilia, we have something called surfactant to keep those airways open. Okay, I'll go crazy on this stuff. This is all skin right here. They go crazy on skin. We'll take care of it really simple. Okay, microvilli, increases surface area. Stereocilia, very long. Stereo just means sound. That's going to be your ears. Those are the things that actually bend, that make it so we can process sound. We'll go into that. We'll go into special senses. If you have your stereocilia is permanently bent, you're going to have tinnitus. Anybody here have ringing in their ears? That is basically as soon as you get done with the military, congratulations, here's your DD-14. You get to exit and here's your tinnitus and 10% disability. Because every time when things are closed, if it's too quiet, I have this loud screeching sound in my ears. That's because my stereocilia is permanently bent and there's nothing that can be done about it. Okay. So these are your cams and all these junctions. The other thing I want you to know about this is we have tight junctions and then we have the basement membrane. Basement membrane is basically just going to be where this epithelial tissue grows out of. That's all. Gap junctions are just spaces so nutrients can go through them. Don't worry about it too much. Luckily, McGraw-Hill doesn't go into this too crazy. Okay. The main thing is on epithelial tissue, we want it to be really tight so things don't get through. One of the big things going on right now, how many people know what leaky gut syndrome is? So a lot of it is in your intestines, your small intestines, and your large intestines. What they're saying is these CAMs, these proteoglycans, they're not holding the cells tight enough together. So these cells actually have a little bit of a space in them. And because they have that little bit of a space, it allows the intestines of the gut to leak through and go into your bloodstream. One of the biggest things that leaks through is actually an exotoxin, toxin means a toxin, from gram-negative, which just means the type of cell wall on the bacteria. So if we have this, it's called a lipopolysaccharide. Listen, lipo, fat, poly, many, saccharide, saccharin, sugar. Lipopolysaccharide, a fatty sugar. It's a toxin. That's what it's made out of. Okay? So, it sounds really cool too. Lipopolysaccharide. You sound smart. It's a toxin made by gram-negative bacteria. If that goes into your bloodstream, it leads to chronic inflammation, which then can increase your C-reactive protein and erythrocyte sedimentation rate and things like that. Causes a lot of problems. Makes you just feel horrible. So, leaky gut. They check to see if we have antibodies to lipopolysaccharides. Why do we have a leaky gut? Because that epithelial tissue isn't held tight enough together. Okay, that'd be maintaining integrity. We have different kinds of epithelial tissue. We're going to have simple. Okay, the best way to understand simple is, okay, I'm married. I grew up with two older sisters. I shared a bathroom with two older sisters. Okay, I don't have emotions. Anything that you can say to me isn't going to bother me. Okay, I was physically abused till I got large enough to one day just grab my sisters and say no more. And then they mentally and emotionally started messing with me. I've been with the same girl for 30 years. Okay, my emotions are covered in scar tissue, and I'm very simple. She comes home when we first got married, walks in the door, and I'm drinking a beer out of the can, eating chips from the bag, and watching a game. She's like, oh, let me get you a bowl for the chips, and pours another beer, and she's trying to be nice, okay? And that was really wonderful. But we've been together long enough to where she understands how simple I am. I'm totally cool with it from the can in the bag. I'm simple. What you see is what you get. One layer. Okay? Simple. One layer. Not confusing. Stratified. A lot of different layers. Okay? I love my wife, but she's like an onion. A lot of layers in there. Some of them make me cry. So, stratified. A lot of layers. Simple. What you see is what you get. Now, why would we have simple? One layer, very easy, just let things go on. Okay? Just kind of chill. Stratified, more protection. Okay? My wife's a Taurus too. Very protective. I'm a Pisces, kind of laid back. So, epithelial tissue, simple, one layer. What if it is squished down? So if it is squished, that's called squamous. Flattened. Cuboidal, looks like a cube. Columnar, long and thin. Pseudostratified means it looks like it's many layers, but really it's just one. Okay. So simple squamous, the main place you're going to see simple squamous epithelial tissue is going to be in our lungs, because we have, in our alveoli, we want it to be very easy for oxygen and gas to diffuse from our lungs into our blood. So, simple squamous epithelial, one layer of squished cells, thick lungs. Stratified squamous, a lot of layers that get squished down. The place we're going to see that a lot is going to be in the mouth, in the trachea, or the esophagus where food goes down, and the other one's going to be in the vaginal canal. So it's going to be in areas where we have a lot of layers. Okay. Squamous is squished, cuboidal is cube-shaped. Cuboidal mainly is going to be glandular. Columnar, we're going to see that in the digestive system. And pseudostratified columnar, that's going to be in your airways. I don't want to go too crazy on this. Okay. Glandular is going to be cuboidal. As you can see right here, the microvilli, what does that do? It causes this is called a brush border. So it increases the surface area. Then usually it's going to have a goblet cell in here. A goblet just means that it makes mucus. So this right here is an alveoli. This is your lung. Take a look at this right here. That is a squamous epithelium. Allows for easy diffusion of oxygen. This right here is a duct, which means it's an opening for a gland, cuboidal. Now, when you see a lot of squish cells and a lot of rows, if it's keratinized, keratin just means skin. Non-keratinized, not skin. Book goes into too much detail on this stuff. I talked about the ciliated. So here you can see the airways with the goblet cells. The secretory, don't worry about this. I don't like how they go about this. Okay, so connective tissue, we'll go into this on the discussion. So the main thing about connective tissues, we have the connective tissue proper, which means it's going to hold things together, but it does have some space in there. So that space is going to allow, mainly what I want you to be aware of is macrophages. When it comes to our white blood cells that fight off infections, a macrophage is pretty much, so on every cell, we're going to have antigens, proteins on this cell. Think of those antigens as tattoos on the outside. So the tattoos can signify what gang you belong to. So a macrophage, he knows what tattoos are in the body. If he sees something that doesn't look right in the body, doesn't recognize the tattoo, he's going to kill it. Okay, so he's like the neighborhood watch. If a cell isn't behaving right, he will kill it because it might be cancer. So he's going to regulate a lot of stuff. When the macrophage does his killing, a lot of times though, he will take that antigen and he will present it to a T cell, which is another white blood cell. The T cells went to the thymus, which is part of your lymphatic system, which is also part of your immune system. In the thymus, the T cells learn to spot danger. Think of the thymus as like prison. If you go to prison, you need to spot danger. So your T cell, when it goes to prison, it learns to spot danger. Okay. When the T cell gets released, it's a helper T cell, a cytotoxic, which means it's a killer, or a memory one. This is your immune system. I'll explain that to you so you'll never forget it when we go into that. Let's see. I don't have to really go about this. It's connective tissue proper, a lot of collagen. Underneath our skin, the subcutaneous, we have a lot of collagen in there. So that's connective tissue proper. This would be your alveolar. The reticular is going to be pretty much like in your elastic tissue, earlobes, around your nose right here. Areolar is just like fatty right underneath your skin. Dense connective tissue, what I want you to be aware of when it comes to like dense means that it's very organized and it's very strong. So your tendons, that's going to be dense connective tissue. Fibrotic, it's going to be like the cartilage and your disc. So they just go into too much on this. It doesn't make any sense. You don't need to know all this. We'll go into bones and muscle and all that stuff in a little bit. That's pretty much all you need on this one. They do a lot on skin. Skin's so easy. I don't know why they go so hard on it. Okay. Skin is also called the integumentary system. So the main thing about it is it's skin plus all the accessory things. So your skin, your hair, which is just keratin, your nails, which is just keratin. Okay, your sweat glands, your sebaceous glands, mammary glands are only found in breast tissue. Okay. We have different kinds of sebaceous glands. We'll go into all that stuff. But the main thing about the skin is because the skin is, you see the skin. You can judge. Like all of you right now are probably looking at me going, oh, I'm looking at Dr. Stewart. And the thing that I've noticed is he has dark hair. It needs to be cut. And it looks like he doesn't sleep well because he has a lot of dark stuff underneath his eyes. Okay. You're right. But the thing about it is you start to evaluate people. As soon as you see their skin, you're evaluating. Do they look healthy? Is the skin healthy? Does the skin have like a kind of grayish color? Does it have like a little yellowish tint to it? That'd be jaundice. So right away you're looking at people. You are now going to be nurses. You know what that means you get to do? You get to be judgy. Judge people right away. Somebody walks in, they got a chili stain on their shirt, they're out of breath, and they took the elevator. Automatically, they're not in good shape. Yeah, they smell like cigarettes, emphysema. You're going to start judging. Okay, now, what does your skin do? So your skin is going to protect you from the environment, the outside. Your skin is also, when it's exposed to sun, it's going to start to produce vitamin D. We need vitamin D for proper muscle development, for proper use of calcium, so vitamin D is necessary. Let me see. Regulates body temperature, we'll talk about that stuff. Just know the cutaneous means the outer portion is our epidermis, which was above the dermis, and the dermal layer. Then we have our subcutaneous, which means underneath the dermis. Accessories is hair, sweat glands, nails. When you hear hypo, that just means underneath. So a hypodermic needle means we're going underneath the skin. If you get a TB test, tuberculosis test, that goes into the cutaneous area that actually make it so you see that little ball that shows up. Okay, so the epidermis is the outermost portion of your skin. That is going to be stratified, squamous, epithelial tissue that's keratinized. The dermis is going to nourish the epidermis. The reticular layer is going to be just underneath the dermal layer. It's going to be part of the dermal layer. And what it is reticular just means it has the elastic tissue. It has everything that gives the skin its pliability. Okay. Let me see. What more detail on this stuff? So, they'll ask you a lot about this stuff. So, what I want you to be aware of is we have your hair follicle right here. So you can see the blood supply that comes in here. You know what happens when you get too much testosterone? Testosterone gets converted to dehydroepitestosterone. Now when you get that dehydrotestosterone, that testosterone now clogs up the blood supply here. So when it clogs up that blood supply, we don't get nutrients, and that causes the hair follicle to die, and that is called male pattern baldness. So, hair follicle. This right here is a sweat gland. You can see the opening into here. So it's going to be a sweat gland. This right here is a sebaceous gland. So this one right here holds the oil that gets released into the hair that gives the hair its shine. We also want to have the oil. That oil is going to keep our skin, the dermal area, pliable. And the oil also waterproofs, just like the keratin. The papillary layer of the dermis, so the dermis is going to be right here where the skin is flattened out, it's become keratinized, and the area right here where the skin cells are starting to grow outwards. The papillary layer just means that papilla just means ridges. So the derma papilla is what's responsible for giving you your fingerprints. The reticular layer is underneath, it's part of the dermis, but the reticular layer of the dermis is going to be where we have all this collagen. This is the stuff that breaks down with age and leads to wrinkles. Inside of the collagen, we're going to have, this is like a corpuscle. Corpuscles can actually tell pressure, temperature, vibration. So it tells you what's going on with the environment when you touch things. Okay, so the functions of the skin. Physical barrier from the world. Regulates body temperature. When it's really hot out, we sweat. The sweat then evaporates off. When it evaporates off, what does it do? It cools you down. When it gets cold, our skin will contract and becomes more dense, the reticular layer. So it's going to hold in heat. And our skin, our hair will actually stand up. When it stands up, it will capture and it keeps more air there so it stays warmer. Okay, so body temperature. Exocrine gets rid of stuff. Synthesizes vitamin D. Sensation, vibration, temperature, touch, pressure. And immune defense, because in our skin, if we get a cut, that's going to be the first site of the immune reaction. So, keratinocytes, most prevalent. So this is the most prevalent cell. What does it do? It is just a skin cell. That's all. Melanocytes. What they do are they're responsible for the coloration of the skin. As you probably have noticed, I am, for all intents and purposes, way more pale than I've ever been in my life. I grew up in the valley. I'm from Reseda. I grew up swimming. I used to surf. When I met my wife, I had blonde hair because it was all bleached out. I was like tan. The reason why I got tan was because the sun's rays would actually stimulate melanocyte production. The melanocytes, what they did was they would actually protect me from the sun's rays, so I would get darker. Now my ancestral roots are, I'm Swedish, Scottish, Irish, and Welsh. So I am very Northern European. So when mankind was formed, the cradle of civilization, they say, in like Egypt, Mesopotamia, My ancestors went north. When they went north, they didn't need the protection from the sun because there wasn't nearly as much sun. So they started to lose their melanin. What they started to do then was they're like, okay, I live in a place where there's not a whole lot of sun. So because my skin is very fair skin and there was a lot of sun during evolution, my ancestors learned how to produce vitamin D very fast. So in 20 minutes, 15 minutes really, of the sun just hitting my face and my hands, I can make enough vitamin D to get through the whole day. But with darker complexion, because you have more melanin, you're evolved in areas where there was more than enough sunlight. Because there was so much sunlight, you didn't have to worry about making vitamin D, so it just takes longer. Now, they didn't realize any of this stuff and how important vitamin D was until all of a sudden factory work came in. And people that actually had more melanin, that were darker, that were working in factories, started to get rickets. Their bones were getting softer because they didn't get enough sunlight. And that's the only difference when it comes to people. The only difference in us is the amount of melanin and how fast we make vitamin D. Merkel cells, sensory. A Langerhans cell is a wandering macrophage, which is a white blood cell that's looking for a problem, looking for a fight. When they ask about the layers of the epidermis, what's the epidermis? The outer portion of the skin, the stuff we can touch. So going from the top to the bottom, the top is going to be the cornea. I always look at it as like a coronation is when a king or a queen gets their crown. So the coronation, the corneum is going to be on the top. The base of anything is the bottom. So as long as I know that the crown's on top and the base is on the bottom, and they ask me the order in which it goes, as long as it starts with the crown and ends with the base, I'm picking that one. The other one's all guess. Who cares about it? And that's just for testing purposes. You're not really going to need this when it comes really to anything else. The only reason I bring this up is so you can actually see. This is the cells starting to divide and multiply. So this is the papillary layer, the base. As the cells go farther up, they start to get squished down. As they get squished down, they get keratinized. As they get keratinized, they get harder. And eventually, the cells of the skin go to the surface and they slough off and they get replaced really quick for the next layer underneath. That's it. Thick and thin, we know about that. Calluses, hands, bottom of feet. Derma papilla, like I said, that's just the ridges. Okay. Just know we have free nerve endings right up here. Those are for pain, sensation, corpuscles, pressure. Sorry about the keratin melanocytes, we talked about that. Accessory dermis. We'll talk about wrinkles and stretch marks in a little bit. When we age, we lose our collagen. That's the main thing. That's why our skin starts to get weakened. Tension lines or cleavage lines. The only reason I want you to be aware of this is because a good surgeon knows to cut along these lines. If you cut along these lines when you go into somebody, it means the scarring is going to be much less. Saying things like this is kind of weird, but it has to be said. If you were to see, I had a patient, she was Eastern European, she was from Russia, and she gave birth through a C-section. The doctor in Russia that did the C-section did not care about these cleavage lines. He just cut right in and took it out. The scarring on her is, basically, they took the baby out, just pushed the skin together and just basically said, don't sneeze, cough, or move. Huge scar. When it comes to an American, when they actually have to do a C-section, they're going to cut right along these lines perfect. And they'll just split it open take the baby out, and just put it. You barely even see a C-section scar nowadays. Right, the doctors are very good. That's a cleavage line. When it comes to thermal regulation, this cuts your erector pili muscle, and what that does when it contracts, it makes your hair stand up on it. Chicken skin. Goosebumps. When that happens, it pulls your skin down, makes it more dense, so it's going to hold on to more heat. Let me see, blood vessels, don't worry. Hair follicles and nails. Sebaceous glands, we'll talk about that stuff. Sweat glands is just basically sweat. It's going to help you like cool down. A lot of studies when it comes to hair, but the main thing is the oil helps to keep the hair looking nice. Clogs up with testosterone. So I hit the highlights here. Why are they going so much craziness when it comes to your hair? Okay. So that's sebum. So we have different kinds of glands. All right. So your sweat glands. They're also referred to as your apocrine glands. Your eccrine glands. The main thing I want you to be aware of is this. An eccrine gland is going to make sweat. That is one we know of mainly. Now, in the military, they would run you so hard, and you do a ruck march, you have your rucksack on, so that's like the backpack. And they would work you so hard, and you would just get so just drenched in sweat. You would take it off, and when your uniform would dry out, you would actually have a ring of salt around you. Like you could literally like salt a pretzel with it. Okay, you could touch it, you could feel it, the grains. Like that is how much came out. So in your sweat, we're going to get rid of a lot of stuff. So sweat is actually somewhat salty. That helps to protect and makes it so that bacteria and stuff doesn't grow. Okay, now, so that's going to be your eccrine, sweat. Your apocrine glands. So an apocrine gland, the main place where the apocrine glands are is going to be in your axilla, which is what? That's your armpit, and in your inguinal region, which is your groin. Okay, so apocrine glands, what they produce is something that's referred to as pheromones. What pheromones do, our pheromones are supposed to have a certain scent that can make you attractive to the opposite sex, which is supposed to make it so that you know. Okay, easiest way to explain it is this. Ladies, have you ever been cold and the first thing a guy does is, wear my coat? He wants you to put on his coat. Why do you think we want you to wear our coat? You don't think we're cold? Yeah, we're cold. But if we get you to wear our coat, because our armpits have been secreting our pheromones into this stuff, because ever since puberty we start to make pheromones. If we can put you in our clothes and you wrap yourself in our clothes, supposedly our pheromones you're going to smell and you're going to be like, yeah, I like this person. Okay, it is a lot easier to try to get you to wear our coat for our pheromones than say sniff my chonies. Okay, everything we do, there's a reason. Okay, so your apocrine glands, they're going to be found where? Axillary in your inguinal regions, and they're going to do what? They secrete your pheromones. Ceremonious glands. What I want you to be aware with these ones are ceremonious glands. So if we wrap you up in our pheromones, maybe everything will work out right, and next thing you know, you're going to come home, we're going to set the romance, or we're going to turn on, light up a candle, have a ceremony. Ceremonious glands, they're in your ear, and they actually make wax. Responsible for your earwax. Eccrine is just sweat. That's all you need to know about this stuff. See, ladies, next time a guy actually says, hey, you want to wear my jacket? You'll know why. And the other thing, too, is if he invites you over and says, I got some champagne for us, I got the good stuff. If the bubbles are large and it looks like he poured you a ginger ale or 7-Up, he's lying. That stuff is like $3. The better the champagne, the smaller the bubble. Yeah, that's all you need to know on the skin. All right, it was 4 chapters. It was a lot. Hopefully, though, if you just watch this, I'll try to make it so the test's going to coincide with this. Um, I'll try to make it so you'll understand. And this is one of the longer chapters, one of the longer sessions because it's four. The other stuff, as we go on with the class, I will start to tie things together better, um, just so you understand how everything works. And I'll try to make sure that you try to have some fun. Those of you who come to these meetings, I appreciate you coming to them. Those of you that are on camera, it's even better. Let me see.